Hello, everyone, and welcome to our monthly community outreach podcast. My name is Ana Isadame, Health Promotion Specialist with Siouxland District Health Department. Today, in honor of Mental Health Awareness Month, we are going to be talking about mental health with Public Health Dietitian Emily Appel. Welcome, Emily. Thank you for joining today. Would you like to tell us a little bit more about yourself, all that you do, and how long you've been with the health department?
Sure. So I am a public health dietitian. I work with the WIC program here at Siouxland District Health Department. I've been here since 2017. And I work with families with the WIC program. So we see a lot of new moms and babies and children. So
Okay. So like I mentioned, May is Mental Health Awareness Month. Why is it important to talk about mental health?
So we know, according to a Siouxland community survey that was done back in 2022, that mental health was ranked the #1 health concern for people in Woodbury County. There's also some barriers to mental health services as well, such as not knowing where to go for assistance, longer waiting periods for offices that accepted Medicaid, and then also lack of bilingual providers.
So there are certain populations that are at a high risk for mental illness. Can you tell us who those people are?
So that's going to be people from LGBTQ, also mixed and multiracial women also, and then people of lower socioeconomic status. We know that those groups of people are at the highest risk for mental illnesses.
So I also understand that depression occurs twice as more often in women than it does in men, and is a pretty common occurrence during pregnancy and after pregnancy. Can you talk a little bit about depression during pregnancy and postpartum?
Sure. So we know that the risk of depression is highest during the last trimester of pregnancy. We know that the incidence of postpartum depression in new mothers ranges from 12 to 25%, and then up to 35% or higher in high-risk groups, including low income, younger age, lower education level, and then also history of traumatic events. Another thing, too, that we actually found in some of our research that we did when we were writing our grant was that low hemoglobin or anemia is also a risk factor for postpartum depression. So that was an interesting finding.
Yeah, that is an interesting finding. So because women are more likely to suffer from depression, especially while pregnant or postpartum, I know that our WIC department is working on some mental health initiatives, correct?
Yes.
Can you give a brief overview of what you're all working on?
Yeah, sure. So basically, we pulled a report of the depression risk assigned for pregnant, breastfeeding, and postpartum women. We found that, and this is data from 2022, we found that 12.4% of pregnant, 10.7% of breastfeeding, and 15% of postpartum women on WIC in Woodbury County struggle with depression. We conducted a survey of our staff to assess understanding of screening and identifying mental illness. And then we also are working on basically doing referrals for mental health if it's identified as a need. And then we're also, we haven't gotten there yet, but we will be working on just kind of working on some nutrition education lessons and kind of educating our clients about nutrition and what they can do with their nutrition and how it can impact their mental health.
That's awesome.
So that's the main thing we're doing.
Yeah, that's great. There is also a mental health roundtable.
Yes.
Can you talk a little bit about that?
So we know that the Mental Health Roundtable meets every other month to discuss increasing mental health awareness, and then also community updates on those as well. So it discusses current activities, and then they're also they will give information on opportunities for various trainings with mental health as well. And I just learned that at one of their most recent meetings, they had talked about how May 8th is Wear Green Day. And that is in support of mental health awareness, and it supports the hashtag Make It Okay. And so they're really encouraging people to wear green and to post on social media. And we know that there are, like, Sioux City downtown partners are trying to work on getting approval for green lights, and the Warrior Hotel is going to have green lights too.
Oh, that's awesome.
So,
Yeah. Okay. Well, we'll keep a lookout for that.
Yeah, definitely.
If the public has any additional questions, who do they contact?
So you can contact me if you want. If you have questions about what we're working on with WIC, you can send me an email. It's just my name, so eappel@siouxlanddistricthealth.org. So you can do that. Otherwise, they can call us at the health department too. So, yep.
Okay. Is there anything else that you would like to add before we wrap up, or think the public should know?
I think the only thing is really just, we want, based on like this, the community needs assessment with, learning that mental health is a really highly identified need. It's something that we just want to make sure we're helping our clients with, and it's just we want to do what we can to help, and we're working on referrals. We've actually worked with Women and Perinatal Mental Health Program at Unity Point's Outpatient Behavioral Health, and we actually had Megan from there. She came and presented to us and gave some information on like mental health referrals, and
awesome.
So
yeah, that's great.
So that's another thing I wanted to add.
Yeah.
So.
Well, thank you again, Emily, for joining us.
Yeah, you're welcome.
If you have any additional questions, concerns, or would like to know more about the Mental Health Roundtable, feel free to give us a call, 712-279-6119. Otherwise, that is it for today. Thank you for joining us, and we will see you all next time. Thank you.